almost 6 o'clock. I think there's medical surgery in the UK. It's about to close. It's my experience for since May to now. Trying to get access to United Kingdom. It's now 5th Wednesday evening, 5th of September 2018. The diagnosis is clear. This is a medical NHS GP. Want to call me back on an 18 number, which I can't really hear, but I hope I can. Just to seek medical advice on my head injury I had Monday night. And I bet they won't ring that number, because they didn't before I had the injury. Basically, I called in the day admin women, who are not the doctors, to see why I've had no response to these blood tests, home visits. No, it's not happening. No. And what was the other three things? Medical records, all being typed up for me. The other letter, they never replied to. There's an email in the letter that was typed up for me. They don't use email, but yet they got PAs, they got emails, and the NHS Net or whatever they're using, digital services now. Yeah, I'm just seeking a simple access to basic advice. I mean, my sister, bless her heart, had done that on text yesterday, and I was so really bad, and the headache, I've taken paracetamols, the drowsiness. I mean, I'm not consenting to East Ambulance, Midlands ambulance people on my own. It's not that serious, I don't think. I'll just have to describe the best I can the symptoms. And there's all these notes, how my sister was helping me while Texas, and my speech to start with, it was really bad bang, and how it happened, I was in my wheelchair. Didn't see the cupboard door open and it hit the corner of my head. So it's just like, didn't knock me out, so I don't think there's anything serious, but it's just a verbal confirmation. If don't know who's going to call, because don't know who's on call. She said, this woman just now, emergency call back. It's not that emergency, but I suppose there's a device on the phone. I don't know. I was sleepy all day yesterday and all day today, trouble to keep awake. I'm on bananas. I think that gives me energy. Does bananas do that? But I've been eating bananas, and that gives me some energy at least. Herbal tea. Yeah, the corner of the cupboard hit my head. And this is over. Yesterday's date was Tuesday, 4th of 9th, 2018. Healthcare professionals. So, I was so ill. Today was meant to call them back, but I've been so sleepy and I haven't been able to get up and about till now again. So that's Monday night, Tuesday, Wednesday, so it's really Tuesday, so it's one off. It's the second day, I suppose 2.5 days. The hours they look at it. So when you look at it online for advice or head injuries, well, it's just, I don't do nothing, because there's quite a few things I'm trying to get sorted out. And I can't keep talking because it's so tiring to keep phoning and trying to speak when you've got other dental ill health going on and all. So what's your name? What's your number? Because they've got one number that the medical people that deliver medications for me, but that's not a very good phone. It's a really old phone and I can't hear them properly on this phone. And that's why I've asked them to call this. I know it's an old phone, but it's a smartphone. It might have better. I said, I've given them options on my. I've given all this bloody information to help me, to help assist me, help them to assist me, kind of thing. And yet, I don't know what's going on with my area, East UK, with people with complex disabilities. I don't know. I know the common sense is ice packs and rest. That's what I've been doing. All these letters, I might have to up because I was getting no response. And they're partners. And it's spelt not very good on his letters. Since Tuesday, 26th of June, this has been going on. 2019, by the way. It's always difficult trying to get community nursing team to offer a home visit blood test and a dental home visit. And why is it? Because I'm so complex. My disabilities, it's not right. Anyway, they're paid. I've been trying to get this NHS advocate right, and she's, for whatever reason, not got back to me. I don't know if it's because the kids are off school or they're going back now, I don't know. When you ring this single point of access number, in my area, it's meant to be integrated care. My mum died as well, so the vet's psychological doesn't, that's separate from this accident recently. But these people, they call it primary care, is it? In the community, medical practice, GPs. They just look at the computer, whoever you get on the end of the line, and they do all these referrals online, and you don't know what's being said about you. And then I've got this crap going on. But what they've appointed somebody I didn't consent to, and he might be the one I'll be speaking to in a minute. Okay, I won't say who he is, I won't breach any confidentiality, I'm not like that. And this is a letter my mate typed up to me to acquire accountable GP to be changed to female that I require. And it's UK, and it's just my head is playing up. Every time I sit up in this wheelchair, I've only been up for an hour, and it's the pressure on my left side of the brain is just constant. Oh, good job I've got a thick skull on their head, isn't it? And it's not ideal the way I live like, because they keep bloody judging me. Oh my God, you'd have to live like this, because of housing disrepair. So anyway, I'm just recording this because the previous individual, who was my GP, is now retired, and basically I don't feel confident with this individual. They pushed upon me since some stuff happened last year, which I'm not going to bring up right now, because this is not relevant for today. And I'm just trying to move on to get the kind of work with people that might help me in the services I need now, because of complex joint disabilities. So that works with a care advocate, social worker, but the cutbacks in the UK. And then we got this medical with Capita, which I know they're going to fail me. Just one thing after another. So basically, I've had 4 accidents altogether in a very short period of time. It's not great, and that's why I need these blood tests to see what's going on, why I'm so weak all the time, And this was, I can't remember much how it happened Monday night, because my friends told me. I don't know if it's because I'm so tired and fatigued. And that's why I've been trying to call up these people today on my bed to chase up about the blood test offered to me home, the nurses. And I couldn't get through. It's frustrating. I wish there's one individual, one department that would be able to, for disabled people with complex needs. You got a health advocate, or what they call it, a wellbeing navigator title role, that can liaise with people for me and work with me so I can get the right support I need eventually. Well, I need it now, but they don't work like that. Everything takes time. So, I've been just so weak, I can't even get into emotional crisis, you know? Just so weak. My body, my arm, this right arm. So I'm left, apparently bananas, that's what I can eat, banana, like I'm like a monkey eating bananas, but needs to keep up the health, because I've got no real good teeth left. I'm trying to keep up my strength. I still need somehow to still do what I need to do, but I know people say you need to rest, but you can't rest when the system don't bloody stop and they don't give you time to rest or grieve. And what they look for is any change in behaviours, which there's a very good website my mate found for me. I don't know if you can get it up, can you? My mate's witnessing this, by the way. They've been very good. They're sleeping opposite me in my settee with a sleeping bag. Head injury, NHS. It's a very good website. 6 o'clock now. Head injury and concussion. Most head injuries aren't serious, which is good. You don't usually need to go to hospital, which is good, because they're so busy with so many people. I feel a burden, you see, with my complex physical needs and care and stuff. And so I don't want ambulance visit, because I don't want to end up there. I wasn't knocked out. That's good. I was just extremely, very, very dizzy and well, within it happening, they hoisted me to bed because I can't walk, and next thing I was asleep. Yeah. So, and does this website, you should make a full recovery in 2 weeks. Right, so I've not been vomiting, that's what you might ask, or he or she, whoever it is. The headache's not gone away, so I'm painkillers on top of what we normally take. My behaviour's a bit odd anyway, because of my complex disabilities. I'm not a threat to anyone. It's just I've got a lot of trauma in my life. It affects me. Irritability. During the night I did. Memory. Concentrate. Yeah, I've noticed that today. I'm trouble trying to think. But that could be just a minor concussion. That might get better. I don't drink alcohol. And I don't do drugs. Apart from the medications they prescribe me. I've not had brain surgery before. I've had similar problems of suddenly losing my body, but this was caused by a blow to the head. Symptoms usually start within 24 hours, but some may not appear for up to 3 weeks. And basically my left eye, well, it's my eye. Well, then it ended up being my right eye this morning as well. I had difficulty keeping awake today. So that's my mate found online about foods that will help with your energy to keep you stable, like. So bananas was the one I had them in. And the vision, I mean, I think it's because I'm tired. Nothing coming at me is, what it says on his website. no bleeding, bruising behind the ears, and no other, apart from what I've got already, numbness in my body, which I already have anyway. And I can't walk anyway, but my balance is the same, unstable anyway. So it's hard for them to judge on the phone. Hit their head in a serious accident. I wasn't in a car crash, so there's no need for A&E. It's just verbal. So basically, I've had cold ice packs. My mate's frozen peas bought me on the head, which I have to. So try which on a special table I have my food at, and I try and balance, and that's when I feel the fatigue, the frozen peas in a towel for the injury, and it says regularly in short periods of time. Its website advice: avoid stress, take paracetamol, but not other just saying what to do, like advising on this website. And for the first 24 hours I had my two friends, one was sleeping on the settee and one on the floor in the bedding. And when it says don'ts, 1, 2, 3, 4, 5 don'ts. Don't take my sleeping pills while you're recovering unless your doctor advises you to. So if they call or said it's wise to take that, and probably they will, because it could be just a minor thing that's happened. See your GP, which is the general doctor. I just call the receptionist to speak to on the phone if you're not sure, or if it's safe for you to drive. I don't drive anyway, I don't travel or return to work or sports. I don't do work or sports. If the symptoms are more than 2 weeks, so it might be premature calling them, I don't know. My sister suggested to call them anyway. If you can't speak to your GP and don't know what to do, call this. This is the number in UK, 111, out of hours. So I don't know what's changed on this website of this medical practice. Can you do that? I might don't like being on camera. I just want to know if there's any changes on this medical website. Oh look, they're doing an online system on the website. This medical practice has joined the Dr. Link pilot study, whatever that is. A series of questions about your condition and will then signpost the most appropriate pathway for your sample, self-help or to see or speak to a clinician. Is this a way to stop people seeing people then? And the information will be reviewed by a clinician at the surgery. As I have trouble dealing with things online. So they still have on the website, right? District team, district nursing team and health visitors, but they're not based there. They're not based there anymore. They haven't updated the website. Yeah. They don't say that the community nurse team are no longer based at the medical surgery, but it's called a single point of access number, and that's a different location in one's area. View my account for GP. See, I thought, well, I read, or mate did read, NHS Constitution, UK, for all patients, that you have a choice who's a named general practitioner. I'm waiting for a call back. Oh, here we go. Hello? Oh, hi. Yeah, hi. Thanks for calling. I just wanted some advice and just check, really. I had a unfortunate bang on my left head, part the top, on Monday night, and I had an accident back into this part of my flat in my wheelchair. I don't know if I was fatigue. I don't know how it happened. I mean, my mates described it. They're trying to put something away. It's late in the evening, and then they left the cupboard door open and it whacked on my head when I tried to go back in my wheelchair in the corner of the cupboard door. Oh gosh, it knocked me. Didn't knock me out. It just I haven't had this before, so as far as I'm aware, my two friends had to stay over and watch me. So basically, I'd sleeping straight. I just didn't wake up, like sleeping a lot, and then obviously speech and all the usual. I think it and my what do you call it, coherent words and stuff was messed up, and so I had to stay in bed basically. So then I'll be like that all day again today. So my sister Sharon, she's texting me like, kept she was okay, like my friends, and this is the first time I've been up in my wheelchair since it happened. So I just called to really, get advice. Don't think it's like an emergency. I think it's what the bang to the head and what on their websites. These websites says what to do and not to do, like ice packs. What else do I do? Painkillers. Um, 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 Eating bananas because I can't eat. I don't feel hungry, so it's just trying to grapes and bananas. And then obviously I thought I'd better ring in just to get some feedback in case, I don't know, the symptoms. Um, yeah, yeah, and all day today, yeah. I've just been up for an hour, and when I sit up, I'm just like lethargic, and I suppose that's a symptom, is it? And just struggle. Like I tried to make a couple of phone calls while I was in bed, and and I just, what time was it? Trying to think, about 12ish today. I couldn't seem to keep awake. So I think that could be the concussion, minor concussion. Could it? Yeah, I've been taking between my normal meds, my every 4 hours, is it? Paracetamol, yeah. Yeah, paracetamol. Yeah, it's when I try and sit out. I'm weak anyway. I'm waiting for blood tests I haven't had yet to see why I'm so weak all the time. And this is another fourth accident I've had, so I'm a bit concerned, obviously, mildly. And so yeah, it's like I got a lump. It's not that big lump, but it's it's enough because I checked it with a mirror, couldn't see any obvious, bruising, but I can feel a lump, but I suppose it's normal for that kind of interaction in that the corner of that cupboard. Is it? Yeah. In the front of my eyes. My because I was trying to get my friends, let my sister know yesterday what's going on, and it's my left eye. It was just above the forehead where it happened, in the corner where the hairline is, and then my eyes started, what's it, blurry, and the left eye first, and then that's it. I just couldn't do anything, and at no point trying to watch something take me off the pain. And then my right eye today, so it's again, those my friends, they just stay in bed and just listen to meditation music, and then when I said, well, give me your phone about 4 today, see if I can ring up blood people, see what's going on. And I couldn't get hold of nobody, Lizzie. And as my speech, it's getting better, but I'm still a bit foggy-ish, like, is that normal? Just takes time to heal? Yeah, I was reading your web, not yours. What's it? That NHS local? Yeah, my friend was doing all that as well today. And if you don't have the bleeding in the ears, which I don't, all the signs, the important things, signs, what it says to look for. I don't have none of that, thank gosh. Uh, um, so because I'm so weak anyway, it's trouble to gauge, you know, if it's still the concussion or my body just so weak. And if it could be a bit of both, that's why I was reluctant to call in, because it could be on just fatigue anyway as well, and it will go away eventually. Not right now, they're not due back for another hour. They just had a break. Yeah, and the city, yeah. I need to go back to bed, so I've texted him to say come back as soon as you can, because I just can't sit up in my wheelchair. I'm just like, my head just feels like I'm falling on this table when I'm sitting at in my wheelchair. So, yeah, I'm not normally like this. I'm fatigued, yeah, but I can normally sit back and have get my words right, Yeah, and that's what I normally take because I'm so tired all the time. It's Pro Plus, and I've run out of that anyway. And I'm just on my bananas. I think that's better anyway. Um, so yeah, so I'm just feeling just like I just need to sleep all the time. Yeah, I just feel tired. Like I can't cope sitting up in my wheelchair. Yeah, yeah. No, it was bad when it happened, and then, as I said, at 12 o'clock today, I just couldn't get my eyes, get me normally wake up okay, and I didn't take my sleeping tablets in case that website they looked at said don't do that in case, and so you would have thought I'd be able to wake up and be alert properly, and so I thought, oh, it's just a concussion, I'll be alright. And I left it hoping by today it's time I'll be back to normal or some getting much better. But this just won't shake off. Right. Sorry, I can't hear you. My phone is crap. Right. Yeah. Right. Okay. Yeah. Yeah. My sister had that opinion, and I'm stubborn. I don't want to trouble anyone. No, she said that. I know. I know. Right. Who do I ring? Sorry. Oh, right. Yeah. 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 No. Right. Yeah. Yeah. So, yeah. Right. Right. Okay. Okay. Thank you. Okay. So, okay. Right. When it sits slightly. Right. Okay. So we'll do that. Right. Yeah. That's. Yeah. 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 Another half an hour or so. Yeah. Yeah. Okay. Okay. Thank you. Yeah. Okay. All right. Okay. Thank you very much for calling. Thank you. Bye. Oh, gosh, there's one thing I don't want to do, but I have to do. You checked over. I'll just text my friend. Oh, I'm tired. That was a very experienced doctor, by the way. Female. Call the 1-1 number. Oh, it's a problem. Oh, right. Plan is I've got to need to call the South Wales. Right. So where am I? Where's my keys? I have to keep my door unlocked because the paramedics have to get in my own. And the problem I've had before, them trying to get in my own, when I ended up in hospital before, I don't want that. Can't find anything usually on the CT scans and stuff. Sorry, I can't speak properly. But then it's just me trying to access what is available. I've got a small bag. I'm going to try and get out in that blinking horrible weather out there. And as you said, I need to do it before I get sleepy. Even more like bedtime kind of thing. I appreciate your effort calling me. Oh, I just don't like ambulance people in my own. Just don't. Oh, gotta turn that phone off. An head injury, that's all. I don't need that. I just don't need the bloody nightmare having a bang on the edge. It's not good. And she knows I can't get to the local clinical centre. Oh, right. I recorded this as someone that's feels frustrated having accidents all the time. Oh. Just, when you can't keep awake, I need to check out she's right. So I'll text my sister and let her know. She can't do anything because she's not in my area. My sister, take care. It's not great. My head up here. Everything is that right. A short period of time. It's frustrating. Gotta go, take care, and hope baby people don't have accidents like me. It's not great. It's not great. I'll keep safe, everybody, because we'll get there in the end. God bless.